Follitropin Alfa 450 Unit Subcutaneous Solution contains follicle-stimulating hormone, FSH, and is used to treat certain fertility problems in women and men. In women, it helps stimulate healthy ovaries to produce eggs, and is usually used in combination with another hormone, HCG, to bring about the growth and release of a mature egg, ovulation. In men, this medication helps stimulate healthy testes to produce sperm, and is also used in combination with HCG. It is important to note that this medication is not recommended for women whose ovaries no longer make eggs properly, primary ovarian failure, or for men whose testes no longer make sperm properly, primary testicular failure. The daily dosage and timing for taking this medication should be discussed with your healthcare provider for the best results. Before starting to use Follitropin Alfa, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Make sure to learn the preparation and usage instructions from your healthcare professional and the product package. When adding the mixing liquid to the medication, do not shake the vial. Before using the medication, visually inspect it for particles or discoloration. If you notice either of these, do not use the liquid. If the medication is stored in the refrigerator, allow it to warm to room temperature before use. Inject this medication under the skin or into a muscle as directed by your doctor. Before each dose, clean the injection site with rubbing alcohol and change the injection site each time to avoid injury. The dosage of this medication is based on your medical condition, response to treatment, and lab tests. Use this medication exactly as directed by your doctor in order to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Make sure to learn how to store and discard needles and medical supplies safely. Some common side effects of Follitropin Alfa 450 Unit Subcutaneous Solution may include headache, mild stomach/abdominal pain, diarrhea, bloating, redness/pain at the injection site, acne, or breast tenderness/pain. However, many people using this medication do not experience serious side effects. It is important to notify your doctor if you experience any serious side effects, such as bleeding from the vagina/uterus, flu-like symptoms, such as fever, chills, muscle ache, tiredness, or swelling of ankles/hands/feet. In rare cases, this medication may cause a condition known as ovarian hyperstimulation syndrome, OHSS, which can lead to fluid buildup in the stomach, chest, and heart area. Seek immediate medical help if you develop severe pain or swelling in the lower abdominal, pelvic area, severe nausea/vomiting, sudden/rapid weight gain, or decreased urination. While very serious allergic reactions to this drug are rare, it is important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before starting Follitropin Alfa 450 Unit Subcutaneous Solution, make sure to inform your doctor or pharmacist if you have any allergies to this medication or other products containing follicle-stimulating hormone, FSH. It's important to discuss any medical history related to fertility problems, abnormal bleeding, thyroid or adrenal gland issues, reproductive organ cancers, brain tumors, ovarian cysts, blood clots, heart or lung problems. Also, be sure to inform your doctor about all the medications and products you are using, including herbal products. This medication may increase the likelihood of having multiple births. If you become pregnant, stop using Follitropin Alfa 450 Unit Subcutaneous Solution immediately, as it should not be used during pregnancy. If you suspect you are pregnant, notify your doctor right away. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. As always, it's important to discuss any concerns or questions with your healthcare provider. When taking Follitropin Alfa 450 Unit Subcutaneous Solution, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without first consulting your doctor. One product that may interact with Follitropin Alfa 450 Unit Subcutaneous Solution is gonadorelin. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Follitropin Alfa 450 Unit Subcutaneous Solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It's important to remember not to share this medication with others. Your doctor may also schedule lab or medical tests, such as vaginal ultrasounds, hormone level checks, or liver tests while you are using this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Follitropin Alfa 450 Unit Subcutaneous Solution, it's important to consult with your doctor or pharmacist to determine the best course of action for resuming your dosing schedule. It's crucial not to take a double dose in an attempt to make up for the missed one. When you have Follitropin Alfa 450 Unit Subcutaneous Solution, you'll need to store the unused vial in the refrigerator or at room temperature away from light, but be sure not to freeze it. After mixing, the vial can be refrigerated or stored at room temperature. Make sure to discard any unused portion after 28 days and keep it away from light. And as always, remember to keep all medications away from children and pets. When it comes to discarding the product, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for more guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.